An accurate diagnosis can lead to a better understanding of the challenges the person is facing, and it may enable the individual to access appropriate support. A range of therapies can help the person to adapt their behavior for a better social outcome, and to deal with anxiety. This can reduce the risk of social isolation. Training may include: Hollywood actor Dan Aykroyd, pictured here on Canada's Walk of Fame, was vocal about his diagnosis with Asperger syndrome. Image credit: Tabersel, 2009. Education and academic skills: a child who receives a diagnosis of AS can benefit from educational support. Aims can include organizing notes, managing homework goals, and addressing any specific learning needs. Most children with AS are best suited to a mainstream school environment. Acquiring appropriate social skills: the individual can learn strategies to enhance their interactions with others, for example, by learning how to read and respond to social cues. Communication skills training: specialized speech and language therapy can help the person learning how to start and maintain a conversation, for example. This also includes learning how to use tone of voice in questions, confirmations, disagreements and instructions, and how to interpret and respond to verbal and non-verbal cues. Cognitive behavioral therapy (CBT), the person learns to control emotions and decrease obsessive interests and repetitive routines. Behavior modification, this includes strategies for supporting positive behavior and decreasing ineffective behavior. Occupational or physical therapy, this can help those with sensory integration problems or poor motor coordination. Medication, there are no medications for AS, but drugs may be used to treat symptoms such as anxiety. Alternative medicine, some studies suggest that special diets, such as gluten-free diets and vitamin supplements, can be beneficial. Anecdotal evidence suggests that a regular intake of fish oils may help with anxiety and some cognitive issues. A review of studies into alternative therapies for ASD, published in 2015, found that, according to anecdotal evidence, music therapy, sensory integration therapy, acupuncture, and massage may help. However, the authors conclude, there is no conclusive evidence supporting the efficacy of complementary and alternative medicine therapies in ASD. The role of supporting caregivers: parents and other caregivers may benefit from learning experiences that help them gain a deeper understanding of AS. By learning some strategies, they can become better placed to support a dependent loved one with AS, and prevent them from feeling isolated. A person with AS can often cope with change if they know it is coming, and if it is planned. Family and other support networks can help the person prepare for change when appropriate. If parents believe that their child may have symptoms of AS, it is important to communicate with the child's school, because educational institutions can offer learning support. The core characteristics of AS are lifelong, but additional support can help the individual maximize their achievements and quality of life. Causes: the exact cause is unknown, but AS may result from a combination of genetic and environmental factors that cause changes in brain development. AS tends to run in families, suggesting that some cases may be hereditary. Some researchers have proposed that environmental factors early in pregnancy may have an impact, but experts have not yet confirmed this. Brain abnormalities may be linked to AS. Advanced brain imaging technology has identified structural and functional differences in specific regions of the brain among people with AS. Complications: social isolation and depression can be consequences of Asperger syndrome. There are a few complications of Asperger syndrome. It can be an underlying condition that fuels other functional difficulties, or the complications can arise from the tics that accompany the condition. Sensory difficulties: some people may have a distorted sensory sensitivity, so their senses may be either intensified or underdeveloped. This can affect how the person perceives noise, bright lights, intense smells, food textures, and materials. Related conditions: young children with AS are often unusually active. By young adulthood, they may develop anxiety or depression. Other conditions related with AS are attention deficit hyperactivity disorder (ADHD), depression, especially later in life, tic disorders such as Tourette syndrome, anxiety disorders, and obsessive compulsive disorder (OCD). Diagnosis: there is no specific test for Asperger syndrome. Physical tests, such as hearing, blood tests, or X-rays can rule out other conditions and determine whether a physical disorder is causing the symptoms. Early diagnosis can be difficult due to the wide range of symptoms, so an accurate diagnosis or appropriate treatment may not occur until adulthood. To assess a child, the team will consist of a pediatrician and other specialists, such as a psychologist. Parents will provide information about symptoms, and the team may also consider observations from teachers. When assessing adults, a professional may ask the person's parents, spouse, and close family members to find out about their developmental history. If you like this video, kindly subscribe in this channel. Babytime FYI. Thank you.